Hi everyone, my name is Cassandra Delgado and I am currently a CPO practicing in Middletown, New York at Prosthetic and Orthotic Associates. I have had a really unique opportunity to engage directly with Adaptech, who are the creators of the new revolutionary Insight system. Today, I'd just like to share my clinical experience with what I've observed over the past year of utilizing the Insight system and how it affected my workflow and the improvements it's made for both myself as a prosthetist and for my patients as well. So a little bit about me. Again, I'm a CPO and currently the Assistant Clinical Director at POA in Middletown. I primarily oversee the lower extremity prosthetic care and full orthotic care at our practice. Our facility was approached by Adaptech a little over a year ago to see if we were interested in beta testing their new scanning tools and socket assessment software, and of course we jumped at this opportunity to work with them. We have been assisting with gathering data for the current research study, along with simply implementing it into our clinical daily practice and providing feedback. When it comes to new technology, I'm always curious as to who the speaker is and what their practice looks like. So I'm primarily split 50-50 with prosthetics and orthotics. I do a blend of different techniques for prosthetic patients depending on the patient presentation. So I'll cast both by hand or scan for sockets. I'll modify my sockets in either plaster or CAD/CAM. So I really do a hybrid depending on the patient's presentation. So moving forward, I'll be discussing this new technology, but I really believe that practitioners that are conventionally modifying their sockets and or using more technology really could benefit from the Insight system created by Adaptech. We've had clinicians in our office with 20 years of experience all the way down to our residents be successful with using the Insight system and really seeing a benefit in their daily practice and continuous learning. So what is exactly the Insight system? For me, I think of it as a diagnostic tool that clinicians can use to accurately assess the socket pressures inside of a prosthetic socket. These two images are screen grabs of one of my patients standing in their left transtibial prosthetic socket. So sensors have been placed inside the socket and an internal scan taken. The sensors are attached to a Bluetooth unit, and then the patient's able to don the socket with the sensor still in place, and a live feedback of their socket pressures will be apparent on a tablet. They're on iPads right now. So here clearly we can see that we do not have total contact on the left picture. That lateral aspect clearly has areas of very high and very low pressure with no even distribution, whereas the photo on the right shows an even distribution of pressure along the posterior aspect of the socket. So how does the Insight system actually collect this data to display it to you and your patient? You start with asking yourself as the prosthetist. I've always started and said, what do I want to know? So for example, if I'm wanting to know if I've achieved ischial containment on my socket, I'm going to place my sensors, which are the second picture, those thin sensors all along the brim, focusing especially on the medial and posterior aspects of that brim. If I'm wanting to assess making sure I have a snug AP or ML, I'm going to make sure my sensors are in these locations. So it's a really thin sensor that has a slight silicone surface to the back so they don't leave any type of residual material on the socket. They stick and contour really nicely because they're incredibly flexible. They do a really great job of adhering to the surface of the socket too. I've used other pressure sensors, for example, that go into like pro boots, and I've just consistently experienced those sensors breaking with heavy weight bearing. And so these are so thin, I've had no issues with them interfering with any socket fits. The patients can't feel them. Each sensor has a little dot that indicates when you take the scan of where those pressure points are, and so it's really helpful to be able to make modifications, which I'll show you later. So you determine where you want information gathered, and then you're going to lay those sensors into the socket for wherever you want to get information from. So for individuals new to my care, or if they're in a socket from another provider, I will just lay sensors to completely cover the surface of the inside of the socket to get a global assessment of how they're looking. The next part of the data collection comes from the scanner itself. So the scanner has a laser that will telescope down into the socket and takes that internal scan. It uses the markers to determine where the pressure sensors are located to give that accurate image back. And on average, each scan takes about 90 seconds. So then when you pull that socket out of the scanner, then you will attach it to the wearable device. So the wearable device, that third picture over, is the connection that is how the sensors can wirelessly connect and send the signal to the iPad. It's a simple Bluetooth connection. And what I really like about this is that I'm not stuck to a gate lab or parallel bars. I've been able to walk in the gravel and mulch around our office I've been able to take it outside down a slope to assess the socket better. It's really been fantastic in that way. And the smaller device seen in that third picture allows us to know where the user is in time and space. So this goes around the pylon, usually just proximal to the foot shell, and allows us to know what phase of gait the user is in for understanding what the patient is experiencing during that time. So this will kind of give you that workflow of how to obtain the pressure data. And I've been asked a lot, how long does this take? So if I have a check socket before the patient comes in, I can preemptively get everything ready. So I'll take a scan, place my sensors in where I want them to be so that I'm ready soon to go as soon as the patient shows up. So I've actually taught one of our clinical assistants and our resident how to do this. So they are actually helping to do some of that prep ahead of time. However, you definitely do not need an assistant to help you. The prep takes about 2 to 3 minutes. The scan takes about 90 seconds on average, and then the 3D model pops up pretty quickly afterward. So all in all, I'd say it takes me about 5 to 7 minutes total to set up the system. It's incredibly user-friendly. It keeps my clinic moving. I won't go on about how we are all feeling the pressure from insurance, and now more than ever, we have to be efficient and be mindful of our time. I can't run over with patients because I've got another one right after it, right? So the technology that I can actually adapt into my clinical practice is one that is easy to set up, simple to set up, and can be done really quickly. And I think AdaptTech has figured that out. It truly seems to be a seamless transition into our practice. So essentially, step 1, you'll put your sensors into the socket. Step 2, you'll put that socket into the Insight system scanner. Step 3, you'll load it onto the iPad, put your patient information in there and hit scan. While it's scanning, you can work in the iPad and put in other data like range of motion, any data that you would normally be able to put into a patient's chart. You can add notes, photos, that type of thing. When that socket comes out, you're going to connect it to the wearable device that will allow that Bluetooth connection to happen between the sensors and the iPad. And then you'll be able to analyze those fits. And then from there, you can make any adjustments as necessary. So I think visuals are always helpful. So I'm going to play this quick YouTube video so that you can have an idea of what the Insight system looks like in action.
With AdaptTech's Insight system, the fitting process is quicker and more accurate. The Insight app saves patients' history and tracks their fitting process, keeping digital records of all appointments. The Insight wearable allows a complete real-time gait analysis with a detailed pressure distribution map. The clinician then makes rectifications to the socket using the data provided by the Insight app and the patient's feedback, delivering a perfect fit and a better experience for the patient.
Sorry about that. Okay. So benefits for clinics. How do I see this impacting our clinic? What have I noticed in all of this? So far, when using the Insight system, typically I'm only needing to do one test socket. My hand modifications get me pretty close on the first go, but the Insight system gives me that last bit of information that takes my sockets truly to the next level of tuning and getting the most comfortable and most accurate fit. This obviously leads to me having more time and resources to see additional patients and to treat them. What has really been great is to have this objective data for insurance purposes. I have been working on trying to get a torsion adapter approved for a very active patient, and insurance keeps telling me this is a luxury item, which is just unacceptable. So we've used the Insight system to show how these differences in socket pressure and limb shear forces are occurring within the socket when they don't have the torsion adapter on, and then when we put that torsion adapter on, how those shear forces are being reduced. You know, we always say this componentry or this item helps to reduce socket forces, right? Now we can actually show that. Insurances are wanting this proof. They don't want to just take our word for it anymore. This is how we can clearly show them what a difference in componentry can do. And I believe this system will really also continue to help train younger prosthetists and our residents. I've been in clinical practice for a few years now and have always wanted to learn something new every day. And I feel like this technology has really helped me just understand the next level of improving my modifications, improving my alignment. I really appreciate how I can see if an improvement in my socket pressure occurs based on those small alignment changes. Normally I'm asking a patient, did that feel a little bit better? Can you tell? And now I'm able to verify that to an extent with the Insight system. So I can make a slight change and not just get that patient feedback, but I can see it for myself if there's actually been an improvement. Sometimes patients come in and they've worked themselves into a bad spot, and you can't tell if what you've done has really helped to offload pressures or give improvements because their limb is just so beat up from not doing the proper sock apply or whatever the case might be. So this actually helps me to see a little bit better what changes that I've made. And I appreciate also that it stores the medical history and their profile. It's easy to reference back that digital library that can be created. So a socket can be scanned, the digital file saved. Let's say you need to carve that file, you can export that. If you need to reference the size of a previous socket, it's easy to get those internal circumferential measurements just by referencing the socket that you scanned. All of these areas lead obviously to a more efficient and cost-effective workflow. And then one of the main benefits I've experienced is the ability to pinpoint the problem areas faster. Historically, how do we fit sockets? We put it on, we stare at it, we watch them walk, ask them how it feels, let them walk a little bit longer, make a few little tweaks here and there, then take their liner off and see where their leg is red. And to me, that is waiting for pain to an extent, waiting for a patient to say where their pain is and looking for that pain or that discomfort. And those steps of practice, I think, need to be a thing of the past. Now, before a patient even takes a step, I can see if they're bottoming out. I can see if they have a loose ML. As soon as they hit heel strike, I can tell if they're getting excessive anterior distal pressure. I can see if they're too flexed in their socket, really without needing them to walk hardly halfway down the parallel bars. This helps me really pinpoint these areas so much quicker. It helps our patients experience less difficulties in trying to explain exactly where the discomfort is coming from or where that pressure is at. I find this really helpful for patients that are new to using a prosthesis. They're not as keen of users. They're not tuned in. They don't know what it's supposed to feel like. Are they actually getting too much pressure on the bottom, or are they still hypersensitive from their amputation? This allows me to see it for myself. Also, we all have those patients with nerve damage at times, and their sensation is just not optimal. Many patients have areas of numbness or extreme hypersensitivity. So this can help prevent inaccurate information, but also help provide information on what the patient can't necessarily feel if they have that numbness. I really appreciate the gait faces as well. I can replay the data, watch it over and over if I want to really nitpick and assess those socket pressures. I can pause it right where they're saying, hey, I'm getting discomfort in this particular area, right? What's really unique also is how the patients are able to see it for themselves. And I'll give more examples of that later. But one area that AdaptTech always highlights is that this system is not meant to replace the prosthetist. You still have to interpret the data that it's telling you. So how have I used this, and what do I look at when I look at these scans? So these are the two images that I showed you earlier. Let's take the image on the left. So this is at loading response. You can see that down on the bottom left. It's highlighted. So at loading response, I'm getting my highest pressures on the anterior distal region and the proximal lateral region, right? But I'm still getting some contact through the rest of those sensors, but those are just my highest points. So to me, this looks like it could be an alignment issue that I would maybe want to try first. So before making any changes to the socket, if I was just looking at this, I would say, you know what, I'm getting contact all throughout. Let me see if I can make an alignment change real quick and see if I can get a little more even of a distribution. And then if not, if that doesn't improve, then I'll definitely heat up my socket, make changes where necessary. But that to me is kind of how I've used this to interpret my results based on also me watching the patient. So usually I'll put them in the sensor system. I will watch them walk a couple times, and then I will reference back the Insight system and that app and watch them watch the patterns flow there and see how they're looking in that sense also. And then the screenshot on the right, this shows me a lot of red all throughout. And I've had to read and understand for myself that red is not necessarily bad, right? Red is just where the highest level of pressures for that specific patient is located. So what does the photo on the right tell me? It shows me, my interpretation is that it has a nice even distribution of pressure on the posterior aspect of the socket. It's likely if I was looking at my anterior sensors also that I have a snug AP, right? If I were to spin that model around and notice that the front is nice and red too, then my AP is nice and snug, holding them up in the socket. The bottom sensors, what this is also showing me is because those bottom sensors are not lighting up more than the top sensors, it shows me that they aren't bottoming out, but they are getting some nice contact there at the bottom, not dropping down too low in the socket. So practitioner still has to determine the best change to make, but now they actually have accurate information to help them make a clinically rational decision rather than just guessing and hoping that that's the right change to make. So where do I see this benefiting patients? This has been one of the most impressive points of this system, truly. And the more accurate of a socket fit, the more comfortable the patient is, the more confidence they have in you and your practice. This means less visits. They can carry on with their activities and what keeps them going. The doctors that I've been able to work with and show them this system are really impressed by the changes we're able to make with our patients and the improvements we're able to do and how accurate we can get. And this helps to continue to build that interdisciplinary team, increase communication, and show them just that we are taking things to the next level. Now, I've really found that it has made my patients much more interested in their care. They have never been able to see their socket like this before. Nevertheless, inside while they're walking and the pressures and what alignment changes can do, what a sock can do, it helps them to understand also why we do the things we do rather than them just having to trust us. They can see the difference that each little step that we're doing is taking and making for their care. All right, so research. AdaptTech has been in the process of collecting data with the main intention to see the ways that the Insight system can improve clinic and patient outcomes compared to a control group. This study is still ongoing here in the United States. They did have a successful study in Portugal displaying some promising results, but like many other things in the world right now, the current health crisis has definitely interrupted a lot of plans that we had for the year, but there's still some really interesting interim data that I would like to show you today. So I'll briefly go over the current study that's going on in the US. Delatour's clinic has also been a user of the AdaptTech Insight system and has really helped to spearhead this first research study in the United States. So the first cohort started with recruiting at POA and Delatour to assist with data collection and then perform the patient recruitment from those clinics. The baseline outcomes were taken of the patients that we recruited, and then they were separated into the Insight group versus the control group. And for the Insight group, the prosthetist would have the assistance of the Insight scanner, and for the traditional group, the prosthetist would fit a new prosthesis in their traditional method. Outcome measures would be taken at the beginning, and then once receiving their device, and then scheduled out from there 90 days with a final outcome report. The outcomes are the standard ones used in the field: quality of life, AMP test that we're familiar with, also the time to up and go measure, the McGann feedback form, and quality outcomes, which is generated in OP. For those of you unfamiliar with this, the McGann feedback form is one that was created at POA and our upper extremity prosthetic focused practice called Handspring. And this has really been a unique way that we have quickly helped patients give feedback on common concerns seen across the board. It's simple to administer. For our patients, anything in the red column, we address that clinic visit. Yellow, we plan to address at the next visit if it hasn't improved. And green means no changes needed, but we're going to continue to monitor it. I've done some additional research with this actually, and would love to chat about this outcome measure if you have any questions, but it's really easy for patients to understand. It gets them thinking about areas that they don't always have on the top of their head. It's easy to translate into different languages. It's easy to use from elderly to pediatric cases. It's been very, very successful for us. So we implemented that into our quality outcomes. And then obviously we are looking at K levels. A majority of you listening should be very familiar with K levels, but AdaptTech created this really great visual for explaining them. It also helps our referring physicians and our patients to look at, and I have attached it to some of our physical therapy handouts and really just use this to explain what K levels mean a little bit better. So thought I'd add that in there. So again, we look at the study. It's not complete. We're about halfway through, but the data so far collected is what we are going to look at today. So this is the Delatour results. So just in terms of where we're at in the study, we're going to look at 6 patients from the study who are part of the AdaptTech Insight group who have completed both the pre and post fitting assessments. So some areas to highlight. Patient 1 was able to go from a K3 to a K4 with a new socket based on their AMP-PRO score. They had a slight improvement in their gait speed during the tug test. Their patient satisfaction still remained the same. Patient 2 was a true K4. So for this, they were actually going from a traditional socket to a running blade. So Drew Buffett from Delator was running behind him with the analysis data and was able to see everything while his patient was running. So, but because this was the first initial assessment and his first time running with the blade, his speed was obviously lower. And because of this, his patient satisfaction score decreased. So hence why we see those red areas there. We did open this study up to any type of patient with a unilateral amputation. And so we know that our patients come in different shapes, sizes, levels, and so we didn't want to reduce the number of people we could use this with when our patient populations are so varied and so different. We didn't want to just keep a very, very exclusive group, and so hence why the criteria was simply having a unilateral amputation with no major other comorbidities. So just so you're aware of that. Patient 3 increased their AMP-PRO score by 2 points. Their tug was slightly slower, but it was slightly slower by a second. So I don't know if we can count half a second as being such a negative, but it was there either way. But their patient satisfaction increased greatly. Also, patient 4 had an increased AMP score, as well as patient 6, and the remaining patients also had an increase in both their ambulatory speeds and patient satisfaction. Again, these are interim promising results for only patient outcomes. And it'll be interesting to compare them to the control group once the data is available and once we have better metrics out there for you. But I am not a researcher. I am a CPO. I am in the trenches with you day in, day out, and I appreciate research. I understand its value completely. But for me, where I see the greatest impact is how it's changed my clinical everyday practice and how much I have learned and my patients continue to learn as we use this technology. And what I'd also like to highlight is the support I've received from the technical department at AdaptTech. They are so quick to answer my questions. They have made changes to the technology to make it more intuitive, to help me troubleshoot any areas that I don't feel completely certain in. I'm not waiting days to have someone respond to me to get feedback. I get to continuously use this technology to the furthest. So just as an example, I had one of those blue kiss lock lanyards at the bottom of a transfemoral socket I was scanning. And because the laser is so bright to take a really accurate scan, it was reflecting off that kiss lock at the bottom. And I wasn't able to get a scan. And so I contacted support. They were instantly able to look at the scan remotely and see that the bottom was getting a reflection. Essentially, we've all been there when you have a new product and you get stuck and you don't know what to do and you can't move forward and you feel frustrated. Not this case. I called AdaptTech right up. They were quick. I explained the issue. They looked right at it. We got a quick solution. So essentially, if there's anything super reflective in the socket, you can do a light coat of spray that will cover up, or a quick piece of tape right over where a really reflective surface is. So those kiss locks are that bright blue, shiny material. And so I just put a quick piece of tape over that, and then we're ready to go with that patient. And so I would just like to really highlight how efficient their tech support is, and very great at explaining things in a very simple, easy to understand process. And it's just been great. So let's get started with some case studies that where I think this product shines the most when I'm a clinician looking at it. So this is Leslie. Leslie's a wonderful patient who has been using prosthesis for the past 24, 25 years now, and I recently took over his care at the practice. And for the record, he has way more to teach me, and I have learned a lot from treating him. But he currently works as a truck driver and told me for the past several years while driving his truck, he would have to take his prosthesis off and shake his leg because his leg would start to go numb while he was walking at work, riding in his truck, all over. And he knew something was off with a plastic artery. He has a plastic artery that was implanted at the time of his amputation due to a compromised blood flow from the traumatic amputation. And so he knew something was off. This plastic artery runs directly between his tibia and fibula. You can palpate it from the surface. It's a little difficult to see in the picture, but my mouse will hover over. It is traveling right there. So, and it kind of continues up. So he has this, it is very easily compressible. If you compress it with your hand, you can cause his leg to go numb. So with the socket, his clinicians in the past have always had to be very mindful of building a little channel there so that it's not over or under compressed. So what was the problem with Leslie when he came in? He had a loose fitting socket, and that meant that the plastic artery was receiving intermittent pressure, causing blood flow in the limb to be either completely free flowing, or if it was pressed upon too much, then it was just blood flow altogether stopped. So this exchange from high pressure, low pressure, high pressure, low pressure throughout the day was causing a lot of this sensations that were uncomfortable, but especially the numbness and needing to take off his prosthesis and shake his leg is just not a good quality of life. So this also meant with his loose fitting socket that he was getting a lot of pistoning and movement throughout the day, which increased his discomfort. So Leslie was shown the pressure map of the socket during standing and walking. His socket was obviously very loose, and so we put a 3-ply sock on, and then we showed him the screen and said, oh wow, look at your pressure distributions. And then he was still loose, so we put a 5-ply on, and he could visually see that redness that was so bright at the bottom when we first took our scan with what he had when he walked in, to now it being much more of a total contact, much more of an even fit. Data was collected and shown to Leslie just more and more how impactful wearing a sock is, right? More than anything, the Insight system helped me to determine whether his plastic artery was being over or under compressed. So the sensors indicated inconsistent pressure in this area, and that it was being under compressed, obviously, without him having the proper sock applied depending on the time of day. So as he loses volume throughout the day, he clearly now understands more so he needs to add a sock, right? But without the Insight system, I wouldn't have known if he was getting too much pressure in that area from bottoming out perhaps, or if he didn't have a big enough channel to accommodate that in his socket. I couldn't tell if the location of his artery, of that plastic artery, is actually in the location that the channel has on the socket. That I had no way to best verify that without having this system. So for me, I would be guessing, right, without having the pressure data. So that's not something I would have been easily able to figure out as quickly. There are ways you could do it, perhaps, if it was in a check socket fit, but it would have definitely been much more difficult to determine. So it was definitely impactful to me to be able to improve Leslie's quality of life. He comes in way less frequently since he's actually able to see what was happening. And Leslie's been using a prosthesis for 24 years, right? I was under the impression that Leslie understood exactly how socks work, exactly how to use his socks, the direct implication of improper use, but I was wrong. The past 24 years, his practitioners have likely been trying to explain this concept to him, and he likely is more of a visual or tactile learner than just an auditory learner. And it finally clicked for him, where he was able to actually see his leg and see what changes in the socket he can do to improve his fit. So for him, it was really a light bulb moment. He has just always kind of been hobbling through and going through his day-to-day and frequently experiencing wounds on the bottom of his limb and being inconsistent with his sock use, really. And so this clearly showed him today what consistently having the proper fitting socket will do and how he can help to improve that also. All right, so the next case I have is Pat. She is a wonderful lady who watches her grandchildren during the day and is currently retired. She's a newer prosthetic user and has been using her socket successfully for the past about 2 years, 3 years now. So Pat came in with 2 issues. One was a distal femur discomfort, and the second was that she just had a femoral stent placed on her residual limb side, and the treating surgeon wanted some offloading to happen. And I knew this was a great opportunity to see what the Insight system could assist me with. So I placed sensors all in her socket, and was able to see that Pat clearly had too much ML movement within her socket. Due to a relief that was made, it made it just a little too loose in the ML. So I added a pad superior to that sensitive area on the distal bone just to stabilize it, which is something that I would normally do, but Pat, again, is a new user, has a difficult time explaining what she feels, and so this helped me confirm that I was making the right decision. and this helped me to determine that what exactly was happening in her system. Pat has kind of been detached somewhat from her prosthetic care, to be honest, because it's been a hard thing to experience for her and her daily activities. It's really impacted her, and so oftentimes she would have a difficult time expressing what she was feeling because it was hard to talk about things. And so this allowed me to really look and see what's going on, even though she's not as keen of a user and is not as fine tuned into her socket yet. So I added pads to superior to that distal sensitive area on the femur, and then I definitely with the Insight system saw that there was less motion, less pressure on that region, but it wasn't completely removed. I was still getting some red on that scan. And so I looked at her alignment next, improved that adduction angle, and the pressure was significantly relieved, and Pat was a lot more comfortable. The second problem was that Pat recently had a stent put into her collapsed femoral artery, and the treating surgeon had cleared her for using her prosthesis again about a week later, but wanted to make sure that there was no additional pressures along the location of her stent. One of my main worries was that it was located on the anterior brim, and there were concerns about relieving too much and losing some stability there. So using the system, I was able to lay pressure indicators directly on a socket where Pat's stent is located. The pressure map showed me precisely where this pressure was, and I was able to see how much I was offloading it and ensuring that I was offloading it. So this allowed me to accurately do that where it was located while maintaining a snug fit without sacrificing my brim shape. I was able to show this again to her surgeon, who was impressed, but more so reassured that the requests for the changes to the socket were successful. And the thing is that the system will allow you to print off and send PDFs of the socket and the pressure maps in a really easy to read format, which is great for documentation and showing those referral sources. So this experience really helped Pat become more part of her prosthetic care. As many do, Pat struggles adjusting to life with a prosthesis, and again, oftentimes is distant and not as talkative during her appointments when we would make adjustments. So this helped her have a better understanding and continue to gain confidence. She was much more confident moving forward because she knew that this area was adjusted. She was really intrigued by how her socket looked, and it made it a much more personal experience for her that she could see on the screen what was happening rather than just having to trust what was going on. So for her, it was reassuring, and that's definitely what she needed. A final configuration that I'd like to show you is how I have recently used the system with an adjustable socket. BOA systems, adjustable sockets are becoming much more popular, much more necessary and helpful for us. So I am utilizing a BOA system from Click Medical and have 2 pre-tibial panels in this and a posterior gastroc panel. And what I learned from the system was that I was getting an inconsistent push from that gastroc panel, and then I needed to adjust the tension of the strings and the pads a little to contact the patient more optimally. And visually, I couldn't see this, right? From the outside, I couldn't see that I was getting way more pressure on the bottom than a nice flush pressure all throughout. And so just with my eyes alone, I wouldn't have been able to know this. Again, my patient is incredibly fleshy, has a lot of redundant tissue, and so they have a difficult time also feeling the stability of the pads all throughout, or being able to accurately tell me, how the pads feel. So my patient couldn't tell that there was anything wrong necessarily at the beginning, but with the Insight system and the sensors, it showed me clearly that I'm getting way more of a push on the bottom than I am higher up, and that I need to make a change. So once I made the change, the patient then told me, oh, wow, yeah, I definitely feel this is more comfortable, this is more supportive, since that posterior panel had a better contact. And this is an area that I potentially would have gone straight to elimination if I hadn't used the system. Everything else looked great. My fit though would have been subpar. It wouldn't have been ideal if I hadn't have had this to know that I wasn't getting a nice consistent pressure all throughout, right? If she's losing volume, I might have lost my AP. I might have had too much contact down at the bottom and caused some distal tibia discomfort perhaps, and not get a nice continuous push from that back panel. So I've had great success using the system in all different types, from suction to vacuum to pin, Revo, adjustable sockets. It's been really successful no matter what I've tried, truly. So thank you so much for just taking the time to hear about my experiences and how truly revolutionary this is for our field, our referral sources, our payers, and ultimately our patients. I know that Cascade USA is an exclusive distributor for the Insight system currently. If you have any questions at all about AdaptTech or the Insight system, they are a great team of individuals that I've had the pleasure of working with. And definitely email them, reach out to them. If you have any clinical questions or are just more curious about some of my experiences, as always, you can email me, Cassandra@poaprosthetics.com, and I'd be more than happy to discuss just how using the system has been for me and some of my experiences. So stay healthy and safe, everyone, and I appreciate you coming and listening today.